Welcome back. In this video we will be talking about gout and calcium pyrophosphate deposition disease. Now these diseases are highly similar in their symptoms and features, and it's very important to be able to differentiate between them when you're solving Q banks or the USMLE exam. So in this video I'll be teaching you how to differentiate between them and how to spot which one the question is asking about. Gout is caused by uric acid crystals deposition in the joint. And usually the trigger is increased meat intake the night before, because meat has amino acids and they will be metabolized to uric acids, so once they increase in the blood they will deposit in the joint. Or by increasing alcohol intake the night before, because alcohol will compete with uric acid excretion in the kidneys. While calcium pyrophosphate deposition disease is largely idiopathic in its cause, we don't know why it happens, but usually it's associated with joint trauma. Gout would usually present as acute monoarthritis, usually one of the knees, plus tophus on top of the inflamed joint. Tophus is basically a nodule on top of the inflamed joint. Calcium pyrophosphate deposition disease have two phases when it comes to presentation. It's either acute or chronic. If it was acute, it will be called pseudo-gout, and if it was chronic, it will be called pseudo-osteoarthritis. Now, gout disease is associated with a couple of conditions, and they are thiazide use, Leishmanian syndrome, PRPP excess, tumor lysis syndrome, and von Uric disease. Calcium pyrophosphate deposition is only associated with hemochromatosis and hyperthyroidism. Now there's a sign that's very important to know in gout, and it's called podigra. It's just a fancy name for big toe involvement. When we take a fluid sample of the inflamed joint in gout, we will see something called negative Birefringent. And when we take a fluid sample of the calcium pyrophosphate deposition inflamed joint, we'll see something called positive Birefringent. What this basically means is that when you say negative Birefringent, it means that the stain we used will stain everything except the crystals that we want in gout. And when we say positive Birefringent, that means the stain will stain specifically the little cubes in calcium pyrophosphate deposition disease. So in gout we stain everything except the crystals, and in calcium pyrophosphate we stain the cubes themselves. It's very important to know that gout presents as little needles and calcium pyrophosphate presents as little cubes. Now for the treatment of gout and calcium pyrophosphate deposition disease, we use the same treatment in acute cases, which is NSAIDs, cortisol, and colchicine. And for the treatment of chronic gout, we use allopurinol and febuxostate. And for the treatment of chronic calcium pyrophosphate deposition, we use colchicine. Alright guys, so that's everything I've got today. Hopefully I made this easier for you, and hopefully when you come to these questions in the exam you're going to be able to answer them. Usually in the exam they'll just give you a history that is compatible with both diseases, so you need to know all the features for both diseases, because usually the answer is in one word or one line the patient says that gives you an idea of which disease it is. So I've put all the features here so you can differentiate between them, and see you guys later.